Hi, I'm Cindy. Thank you so much for allowing me to speak today. I think everyone can agree that it is time for a change where our nation's healthcare is concerned. The current insurance options in place are just not accessible or affordable to many Americans. Because treating costs of chronic conditions such as coronary artery disease, diabetes, and congestive heart failure, just to name a few, are so high, working to prevent these conditions would be so much more cost effective than actually treating them. With early intervention and close monitoring with regular follow-ups, time, money, and resources could be saved with this. Other incentives for getting healthy could be placed in the hands of employers. I once worked for an employer who offered incentives to its employees for healthier living. If an overweight employee lost weight or a smoker quit smoking, those employees were offered lower insurance premium rates. They were also offered discounts on gym memberships, encouraging and supporting a healthier lifestyle, reducing the costs of health care. I also feel that insurance companies should be mandated to provide preventive care to its members at no cost, no out-of-pocket cost to the member. According to the Centers for Disease Control and Prevention, too many Americans go without needed preventative care, often because of financial barriers. Even families with insurance may be deterred by co-payments and deductibles from getting cancer screenings, immunizations for their children and themselves, and well baby checkups that they need to keep their families healthy. Preventative care paid at 100% by the insurance company motivates patients to seek preventative care more often than if they were required to pay out of pocket for it. The right preventative care at every stage of life helps all Americans stay healthy, avoid or delay the onset of disease, keep diseases they have already from becoming worse or debilitating, lead productive lives, and reduce cost overall. Also, eliminating pre-existing condition clauses and lifetime maximums should also be implemented. It is unfair to consumers who pay monthly premiums for years on a policy to be diagnosed with a condition requiring long-term care, to be told their policy will eventually max out and be canceled once that lifetime max has been reached. It's also unfair and unethical for an insurance company to refuse to cover a member simply because they have a pre-existing condition. Another intervention could be to implement healthier options for snacking and healthier lunches to America's children when they're at school. According to the Centers for Disease Control and Prevention, childhood obesity has more than doubled in children and adolescents in the past 30 years. And in 2012, more than 1/3 of children or adolescents were overweight and obese. Childhood obesity leads to cardiovascular disease, diabetes, and other diseases, chronic conditions that later on in life, increasing healthcare costs overall. Striving to keep our children healthy can significantly decrease future healthcare costs. Part 2. The top 3 things I've learned in this class. 1, the process of how a bill is introduced and either passed or vetoed. 2, I also learned that no matter who you are, what your background is, or what your education level is, you can make a difference. 3, I learned a good bit about healthcare reform. What I learned in this class was important to me because I love that I know now that I have the power to make a difference. I have the option to be part of change, to be part of changes in the healthcare system. It's also important for me to learn more about healthcare reform, which I did, to know exactly how it's going to affect me later on. Being in school to be a healthcare provider, just knowing how it might affect me once I begin to practice was important to me, and learning these things made such a difference this semester.